America, as you know, is halfway through the federal government's 15 days of recommended social distancing. Our Dr. David Agus is in Los Angeles. He's also social distancing. He's at his home in Los Angeles. Let's start with the president, David, because he appears to be at odds with the health experts about how long this should go on. If it comes to that, who wins in this dispute, and what is the risk there?
Well, I think everybody thinks that it needs to be a 4 to 6 week minimum of what we call the social distancing now. Remember, each person in the Chinese data can actually spread to 2.5 people. So if you stop it and there's still virus, it will keep going and grow up again. So we have to be clear on that. My gut is, obviously science will win and the data will win. And I think my hope, what the president is saying is, let's see data every day and see where we are and then make a decision based on the data. Let's not say in advance that it's going to be X number of weeks. And that I buy into. The key thing here really is to see what's going on. And so what we're going to see is the end of this week, we're going to see the impact of what we all have done the last week, which is draconian measures. We all have played a part and stepped back and hopefully dramatically stopped the spread of the virus.
Yeah, but he says, let's not let the cure be worse than the problem. Does that make sense to you?
Well, again, I'm not an economist, but what I do know is the economy won't do well if the virus keeps going. And so I think you have to look at it on both sides. And so if you open the economy and the virus keeps going, we're going to be in a worse situation than we are in now.
Well, you should say, David, most businesses probably are not likely to reopen if there is still a health crisis. But I wanted to ask you, how will we know when it is safe to loosen these restrictions?
So we need to see stop the spread of the virus. So community spread, which is person-to-person spread, has to go down dramatically in order to loosen the restrictions. It's a numbers game. And at the same time, if we start to have treatments, so let's say we do find somebody with a virus and we can actually give them a drug that we know works, we can actually stop the spread from him to somebody else or her to 2 other people.
Doctor, the president raised the specter of suicides if the economy tanks as badly as some economists think it will. There is a term for that in the literature, deaths of despair. Is it legitimate to calculate those sort of fatalities against the fatalities that come with the virus itself?
Of course, you have to look at the whole picture, right? We are an enterprise. And so you cannot just say, we're going to put everyone in their house, forget the economy, forget jobs, or we're going to have social disruption. We're going to have young people start to go into the streets and say, I've got no income, I can't survive. And so it needs to be a hybrid of those. And, as we get more and more science and data, we can figure out exactly what to do.
So as we think about potentially opening up sectors of the economy or portions of the country, one idea raised by the president is that certain parts of the country, less hard hit, could come back sooner economically. Is that a legitimate approach?
Listen, I think we can open certain parts of the country potentially, although I'm not sure that's going to be likely. But the other side is people who've been exposed that has antibodies to the virus and it's safe for them to go out. They can be an upstart part of the economy. We can actually differentiate. Elderly haven't been exposed, very high risk. If you have been exposed, you can go out.
Wait, David, before you go, Dr. Fauci wasn't at the press conference yesterday. A lot of people find his presence very reassuring. Was that a surprise to you that he wasn't there? I know you've talked to the White House about different things. Were you reading too much into it?
Yeah, I think, I hope is they want to social distance and have a small number of people. You can't have a panel of 10 people speaking at every conference. He's a reassuring voice and he's real science and we all believe in him.
All right, David, thank you.